The following content is intended for informational and educational purposes only. It is not medical advice, nor is it a substitute for advice or treatment from a licensed medical professional. It is not an endorsement of any kind or nature pertaining to any therapies, products, business models, or companies. As a practice of self-agency and as a wise advocate, you should always consult your own medical expert. Welcome to Beyond Pink Foundation's podcast, Thriving Starts Here. I'm your host and fellow breast cancer thriver, Michelle Hauser. Today we're visiting with Jill Meyer-Lippert, a registered dental hygienist and also the founder of Side Effects Support, an online resource center to help cancer patients, caregivers, and healthcare providers reduce harmful oral side effects of treatment. Her mission is to reduce infection risk and improve comfort, confidence, and quality of life during and after treatment. Jill is the recipient of the SunStar Registered Dental Hygienist Award of Distinction, and she holds a certificate in oncology management. Jill serves as an instructor of the National Network of Healthcare Hygienists Oncology Program and as a member of the Registered Dental Hygienist Advisory Board for the Oral Cancer Foundation. In 2022, Dimension of Dental Hygiene magazine recognized Jill as one of the 6 hygienists you want to know. And we are going to get to know Jill. Welcome, Jill. Thank you for joining us today.
Thank you for the invitation.
Absolutely. You have an important mission with oral health care, and I'm curious, what led you to that area for breast cancer patients?
My inspiration really stems from my mom's breast cancer experience. She was diagnosed at almost the same time that I started my first job in the dental field. I was working as a dental assistant, and she suffered horribly with so many side effects from her chemotherapy, but so many side effects in her mouth. And it felt so helpless for all of us to not know what to do to relieve some of those issues. So it really inspired me to learn more that I could help others that were facing these same situations.
What a wonderful story. And I know you've been touched by breast cancer through your family members, and you have a heart for the breast cancer community, especially with your bags that you're offering that we'll talk about more at the end here. Can you tell us about some of the side effects that occur while in treatment?
Yes, a very, very common side effect with many breast cancer treatments is dry mouth. And dry mouth is something that can lead into several other types of side effects. So the drier your mouth is, the more likely that you will have problems with developing cavities, developing infections in your mouth, especially the thrush infections. It will make you more likely to develop mouth sores or what's called oral mucositis, which is also common with many chemotherapies. It also can make you more susceptible to having taste changes. And that's a very common complaint during cancer treatments as well.
What can patients do to mitigate some of these side effects?
There are several things, and surprisingly, sometimes the things that you can do are really simple, and they can prevent a lot of really severe problems. Just being proactive. So part of it is, first of all, knowing what you're at risk for, and then trying to take action before the problems start. Unfortunately, too often, we wait for the problems to start, and then we're trying to put fires out. So being very aware of what the risks are, taking simple steps, and sometimes it's something as elementary as just looking at what type of toothbrush that you're using. And I've got an example here. So this is an example of a general toothbrush, would be pretty common for anybody to pick up in a big box store or a pharmacy, but it's so big. And a lot of times those bristles are really stiff. And ideally, when you're in treatments, you want to use an extra soft, compact head toothbrush. The smaller head and the extra soft bristles are going to make brushing more possible if your tissue starts to get sore or if you do develop ulcerations inside of the mouth sores. And it's also easier to clean without causing toothbrush trauma. So you can reach areas, be more thorough versus a large brush like that. So that's something simple. Also treating dry mouth. As we talked about, dry mouth can lead into so many other issues. So we know you're at risk for a problem like that. There are a lot of oral moisturizers out on the market that can help lubricate the tissue. That's going to be more comfortable. Is going to help reduce your cavity risk. Is going to help reduce your risk of mouth sores, taste changes, and all of those problems.
Oh, yeah, and I know what it was like going through treatment with the dry mouth. That was a big issue. And then just general changes in my oral health. And I recall talking to my oncologist about oral health at that time. How do you combine oral health as in dental care during and with treatment?
So ideally, there's a window of time typically between diagnosis and actually starting treatments. In the ideal world, that would be a golden opportunity to see your dental provider. Make sure that you're not going into treatments with any active cavities, with any active infections in your mouth that could spread into bigger problems during the treatment process. Also, to make sure that you have good documentation of what your oral health looks like before you start treatment. So then you know what kind of changes have taken place once these treatments have been completed. And then we can take all the puzzle pieces and put them together. What type of medications are going to be administered, what type of treatments, what kind of oral side effects are at risk with those types of treatments, how healthy is your mouth going into treatments to begin with, because a really healthy mouth is going to be less likely to have some of these problems, but they're not immune to it either. But we put these puzzle pieces together, and then we can start taking action as far as what type of oral hygiene tools are you using, what kind of products are you using. Sometimes it's just avoiding certain ingredients and products. And then we can start those changes early and help reduce the risks. And even if we can't avoid them altogether, maybe we can delay how soon they start in the treatment process and then to minimize how severe they might get.
So, what happens after treatment? Is oral health still an issue?
Oral health needs to remain a priority after treatments are complete. We are learning so much of what is called the oral systemic link, where we are realizing now that certain bacteria in the mouth, certain oral health issues, put us more at risk for all sorts of health problems. They increase our risk for cardiovascular disease. They increase our risk for Alzheimer's disease. They increase pregnancy complications. And they're finding out now that
Yeah.
certain oral bacteria can actually increase your risk for developing certain types of cancers, including breast cancers.
Wow.
So it's really exciting because as we learn more about this, it's going to open up opportunities to not only have better ways of early diagnosis, figure out who's most at risk, but opens up pathways for possibly new treatments or new ways of prevention. We really need to keep in mind that our mouth is connected to the rest of your body, and the
Mhm.
healthier that we can keep our mouth is going to help keep you healthier in general.
Yeah. And I've heard that about flossing, that that can extend your life by a few years. So think of the power there. I'm not surprised how important oral health is with regard to the whole body, the whole system, and how it can impact your quality of life.
Yes. And we often think of the physical aspects of it as far as pain, as far as comfort levels, things like that. And now this oral systemic link, but then to also think of the psychological and social aspects that poor oral health can have on somebody, because we realize now that poor oral health can affect relationships. Sometimes people become, and I've seen this unfortunately, become very self conscious about their teeth, their smile. Some people will avoid social situations because of that. It can affect employment opportunities. And I've unfortunately seen some cases where people will become so ashamed of the condition of their mouth that they prevent themselves from smiling, and
Mhm.
they will force themselves not to smile. And unfortunately, that has psychological impacts that can lead to more cases of depression, more cases of anxiety, and actually increases in pain levels.
Yeah, yeah. So it's not just health as in bodily functions, but it's mental health too. Are there oral side effects associated with any of the medications that a breast cancer patient may take?
Yes, there are many medications, both over the counter and prescription, that can affect your oral health. And the more medications that you are on, typically, the more likely that you will have some of these issues. I'll go back to dry mouth again. That's a huge problem for so many over the counter and prescription medications. Now, if somebody's taking two, three, four medications that all have that as a side effect, it just keeps compounding the risks of that being a problem for them. But there are certain medications that can be associated with breast cancers that sometimes are used long term that can definitely affect oral health. And some examples of those would be sometimes hormone suppression is part of the treatment process. And people may be taking these hormone suppressing medications for several years after chemotherapy or after radiation. And those hormones are needed to have like healthy bone density. A lot of times, dry mouth comes with that. So those can all have problems. Sometimes taste changes come along with those hormonal changes. And sometimes antidepressants or anti-anxiety medications are used during the treatment process and may be continued after the case. And those can also cause dry mouth. And there are certain medications of those classes that can cause a very odd side effect where they can make somebody clench or grind their teeth more. So all of a sudden, people may notice,
Ooh.
like, oh, I'm developing more of a headache. All of a sudden, my jaw joint is hurting a little bit more. I'm getting clicking or popping in my joint, or all of a sudden they're breaking teeth because of all the extra pressure that they're putting on them. Something I really wanted to mention is I stated before about bone mineral density being an issue. Sometimes through the treatment process, people may be more likely to have osteoporosis, osteopenia, and the medications that are used to treat that can have a risk. And it's a very, very low risk, but it's a real risk for something called medication related osteonecrosis of the jaw. So it's a problem that can affect the jawbone. Sometimes those same medications are used for our stage 4 metastatic cases, especially the ones that have spread to bone. And then those typically are used at higher doses in those cases, which can raise your risks a bit for those. And those can be used long term. So it's really important if somebody's taking one of those bone building medications, like a Zometa, like Xgeva and a Prolia, that your dental office is aware of what medications you're taking, what the risks are, and then when we're making treatment decisions, that we're taking those into consideration to make sure that we're treating you as safely as possible.
Well, I've learned so much from talking with you today. I mean, so many things I went through during my treatment with oral health and even tension in the jaw that I had no idea was connected. When thinking about the big picture, as a breast cancer thriver and the breast cancer patients and thrivers that are watching this podcast, what can they anticipate in the long run once they've run into some of these side effects that you've talked about? Is it permanent or are there treatments and therapies that will relieve it in the long run?
Part of it is, again, just being diligent with your dental care, your professional dental care, being diligent with your oral hygiene at home, making informed decisions of the products that you use. There are certain products in the market, unfortunately, especially ones for dry mouth, that are acidic. So they may relieve that symptom and end up causing more problems down the line. So making sure that if you're using certain products that you get recommendations from a trusted dental professional that's taking those things into considerations. If you're being diligent with all of those things, it's going to help reduce your risk quite a bit. But part of it is just being informed, understanding, being your own biggest advocate. I think that's the biggest thing
Yeah.
is really taking control of your own situation, learning as much as you can, and then taking action, especially not waiting for problems to start.
Yeah. And talking about being your own advocate, which is so important, you shared a story with me about a breast cancer patient who said, my hair will grow back, but my teeth won't.
That is a saying that just truly it hits my heart to this day, and this was many years ago. We had a longtime patient at the dental practice where I was working, and she unfortunately was diagnosed with breast cancer. And she knew that I had a special interest in this area. So she was able to come in before starting treatments. We were able to give her all the information, get her all set up with product recommendations, and make sure that the tools that she was using would be appropriate for her needs. So when I was able to see her back that first time after treatments were complete, she said, "Oh, Jill, I am so nervous of what you're going to find." She said, "But I just didn't want to brush so many times. She said, I was tired. I was nauseous. The last thing I wanted to do was put a toothbrush in my mouth. She said, but I remembered what you told me. And I kept telling myself, do it anyway. My hair will grow back. My
Mhm.
teeth won't. And that was her motivation that she used to
That's
keep
awesome.
her oral hygiene up during the treatment
Mhm.
process. And thankfully, she came through and didn't have a lot of problems. But I think that is so true that I never want to downplay at all the how traumatic hair loss can be. Absolutely. But that will come back versus if we lose teeth, we lose our oral health. There can be much longer complications and
Right.
consequences with that.
Well, thank you for all of your pointers today and making us aware knowledge is power. So, thank you for sharing the knowledge. You have a few gift bags to gift our breast cancer community. Will you share
I do.
what's in those gift bags?
Yes. So there are several products in these. They are chocked full of amazing products from companies that I love and I work with in different ways. So I will give you a brief rundown. Part of it is my brochure. This is an informational brochure that's free to download in English and Spanish on my website. And it goes through what some of the problems may be: dry mouth, mouth sores, things like that, and really simple tips of things that people can do at home to help reduce or manage some of those issues. I do have information about a prescription product called a Quarrel that is a lipid based. So, what makes it different is a lot of the dry mouth products are water based. This is lipid based, so it puts more of a coating over the
Mm.
tissue for longer lasting results. It's prescription spray. It can be used on its own or in conjunction with another product to get longer lasting results. I have what's called an Intelligent Toothbrush Shield sample, and this is something that can go over the toothbrush to help protect the toothbrush from germs. And when our white counts are so low, and if there's mouth sores involved, it's so important that we don't let the toothbrush be an infection source with bacteria. There's information in here about a rinse called Metakill. This is specific for reducing metallic taste changes.
Okay.
I have two products from Elevate Oral Care from their All Day line. There's a dry mouth spray and a dry mouth gel, and these are amazing for reducing dry mouth symptoms. There is a toothpaste from a company called Spry. A lot of these products are xylitol based. So xylitol is a natural sugar substitute, and it looks like sugar, it tastes like sugar, but it has a different carbon structure. So it doesn't allow the bacteria that would typically eat the sugar that we eat to cause cavities. They can't digest it. So with using xylitol products on a regular basis, you actually help to improve that whole bacterial balance inside of the mouth. There is a mouth rinse called Closest Ultra Sensitive, and this is non-flavored, very gentle, and I just get great responses with that. I also have two examples of compact head extra soft toothbrushes from Tepe. One is called the Special Care and one is called the Gentle Care toothbrushes. And they're almost like a baby's hairbrush. They're so gentle and nice compact heads for cleaning thoroughly. There's also a sample of Periovance dry mouth gel. This is another great option out on the market, and it has a discount code associated with that. There is a paste from a company called Carry Free. The whole Carry Free line is based on that whole concept when I mentioned that some products are acidic. Theirs are alkaline to help balance out the oral pH and protect against cavities that way. So this is just one of the products that they offer, and that also has a discount card. This is a toothpaste sample from a company called Dr. Jen's. This is a non-fluoride. This one particularly is non-fluoride, but they do also have fluoride toothpaste that have nanohydroxyapatite. So that is another agent that helps to reduce risk of cavities. And so this
Very
also
nice.
has a discount card. And then we're heading down to the end here, but a few other things that I've got are a variety of gums and mints that are also xylitol based. The xylitol will help to stimulate circulation or stimulate saliva to reduce dry mouth symptoms, but it also helps to improve that oral microbiome. So I've got some from Spry, I've got some from Dr. Hef's that are all xylitol based. There's actually a nasal spray, a xylitol nasal spray that helps to keep those nasal passages
Very nice.
lubricated and cleaned out. So that way people don't have so much trouble breathing through their nose, and that avoids
Mhm.
mouth breathing.
Yeah.
And then The only other things I have in here are a discount card for something called Soothie Frost. It is a vitamin infused ice pop. So, with certain types of chemotherapy, sometimes sucking on something cold can help to reduce risk of oral side effects by shrinking the blood vessels inside of the mouth. So, this is an option for that. And the last thing is information about an oral microbiome test. So, there's actually tests now that people can do at home. They can just collect a little saliva, send it in, and they can have an analysis done of what type of bacteria are in their mouth. And then what I love about this company too, they have an oral care consultant who's an expert on things like this. And when you have those tests, you can actually schedule an appointment to talk with their consultant and get specific recommendations of what you can do to improve that oral microbiome. As we know so much more about that oral systemic link, that's a great gift that somebody can give to themselves.
Wow. Thank you so much for these bags. We're going to make them available for the breast cancer community. We have a limited supply of 5. So, to the audience, be sure and like and follow us on this podcast platform and then tag us on social media at Beyond Pink Foundation and comment Oral Health Matters for your free bag for the first 5 to respond and tag. Thank you so much, Jill.
Thank you.